The following segment is sponsored by Intermountain Healthcare and the Utah Department of Health.
We didn't anticipate quite the surge that we're seeing this year.
RSV season started early this year. It typically begins in January, but doctors have seen infections as early as October.
We've seen this year a huge surge of RSV disease much earlier than that. The last 2 months have been quite heavy.
The most severe cases are in babies under 1, but now there's an increase in cases among older kids. Doctors believe it's due to pandemic precautions. More children didn't get RSV in the last 2 years, so they didn't have the immunity.
This is a virus that everybody gets. By the time you're 2 years old, you've probably had RSV once or twice already, and you continue to get exposed to it throughout your life. And so having this period of time where maybe we were less exposed is likely the explanation for the surge we're seeing now.
One major sign is struggling to breathe. If you notice the skin around a child's ribs pulling in or a blush color in the face, it's time to seek care.
RSV, unfortunately, isn't a virus that we can cure. We can't treat it in the way that we would treat an ear infection with antibiotics. However, we can provide the kind of support that kids need while they get over it on their own.
There's not a vaccine for RSV yet, but one is in the works. In the meantime, doctors encourage getting vaccinated against COVID-19 and the flu.
One of the most important things we can do is make sure we're protected against those other respiratory viruses. Certainly, the last thing you want is a case of influenza on top of a case of RSV.
And hospitals are already busy, and RSV has likely not even peaked yet here in Utah.
It's still a big deal, and we're likely to still continue to see RSV for the next couple of months at least.
I'm Jade Elliott for Baby Your Baby.